An arrogant doctor barges into an examining room. First words from his mouth are, "What's wrong with you?" The young woman on the table says that her belly hurts, and it hurts when she urinates. He immediately assumes urinary infection, prescribes antibiotics, tells her it's going to be okay. He knows that it's just a matter of 2 or 3 days and she'll feel fine. He fails to recognize her main concern is pregnancy, and she's afraid that the treatments will harm her baby. In addition to being rude and arrogant and incomplete, this doctor has used a paternalistic and father knows best approach without engaging his patient's feelings or thoughts about the treatment process. Hi, I'm Dr. Jeff Crane, and in this video I want to give you some tools to think about 4 basic ways that we interact with patients, 4 different models that we can use to help choreograph the way that we interact with different types of patients in different situations. I think there are some very core principles that drive healthy doctor-patient relationships. Those are things like trust, respect, dialogue, and partnership. These all lead to a final pathway of shared decision-making. What that means is that the doctor and the patient both give input into how treatments are given that affect the patient's life ultimately. The Creator God has designed us with inherent respect, and that ability to show that trust and respect of people is an important part of the way that we should act in a very ancient, time-proven profession called medicine. The 4 models are called paternalistic, informative, interpretive, and deliberative. And they can be summarized on this slide to say that in the paternalistic model, the doctor acts as a parent or a guardian. In the informative model, the doctor's role is to just give information. Interpretive models add to the giving of information an explanation, but they don't evaluate the values of the patient to decide what he or she may want. In the best, most complete form, the deliberative pathway, the deliberative model, lets us dialogue with our patients, explore values, and give advice as healthcare professionals. In the paternalistic model, there's an assumption that the patient will be thankful for what I do for him or her, that I will be the best caregiver because I know best, and I'm a guardian, priest, father figure over this child who needs my evaluation and care. Examples in the paternal model would be things like treatment of an unconscious patient in the intensive care unit during a code. The patient can't give any input in that setting. Another would be pediatrics. In most cases, our pediatric patients don't have an opinion about their care. So the paternalistic model has a good role in some situations. The next model is the informative model. Here, it's like a laboratory just gives you a report showing that your COVID-19 test is positive, or that you have hepatitis B, or that you might sign an informed consent document to say that you agree to surgery. These share information without any content of interpretation or value assessment. In the third model, called the interpretive model, there is a dialogue. This is the beginning of a partnership in which information is shared and an explanation is given. For example, a young woman who has maybe a 1 centimeter estrogen receptor positive cancer of the breast is told by the doctor that she can either have a mastectomy or a lumpectomy and radiation. He assumes that she has the value system to decide which option to take and leaves the decision purely to her. Now let's move to our final pathway, the deliberative model. If we pick up that same 1 centimeter estrogen tumor, receptor positive tumor, the doctor may say, "Mrs. Jones, you have a small tumor in your breast. We're going to need to do something about it. I recommend that you understand 2 main options exist, lumpectomy that conserves your breast, and radiation, which will take you through several months of treatment with other doctors, or a complete mastectomy, in which case you'd lose your breast. I'd like to know how you feel about those 2 options. Entertain your questions about them, and then I can share with you my experiences over the past 20 or 30 years treating women like you." That represents a partnership, a dialogue between the doctor and the patient, where each has vital input and information for the other. So in summary, we've talked about 4 basic models: paternalistic, informative, interpretive and deliberative. The last two, interpretive and deliberative, are partnerships. The first ones are just execution of actions, giving of information, giving of treatment without any regards to the patient's input. The last two are partnerships, and we do want to build a partnership with our patients. Let's talk about what partnership looks like for a moment. It's not appropriate to call a patient the gallbladder in room 4 or the myocardial infarction on its way to the emergency room. Partnering with a patient starts with respect and giving them the options of talking with you and voicing their opinion. The most important part of partnership is education. As we educate our patients about what their body is doing and what the disease process is doing to their body, we give our medical knowledge to them so that they can make an informed decision. I like this slide because it shows how education transforms simpler models into more complete models. Education adds value assessment, and deliberation allows both the patient and the doctor to share their values in a way that the best possible medical decisions can be made. In the final models that show the highest level of partnership with the patient, there are two key things called empathy and sympathy that play. Empathy is the ability to put yourself in the place of the patient and feel their feelings, share as they see the world, and understand it from their point of view. Sympathy, on the other hand, is a statement of emotional concern, a desire to simply see the patient free from the pain or the distress of the medical illness. So, in summary today, I've shared with you 4 models in the doctor-patient relationship, each with an increasing level of shared decision-making, each appropriate to different medical situations. Our most complicated illnesses really need a deliberative process in which the values of the doctor and the patient have an input into the final decision-making process of what happens to the patient. I think it's important that we educate our patients, and education plays a vital role when it's used with empathy and sympathy to give the patient those abilities to make decisions on their own behalf. Thank you for listening today.